एक चीज़ हम हमेशा बात करते हैं इस शो पर, हेल्थ की तो बात करते ही है, बट हेल्थ में भी हम शुगर की हमेशा बात करते हैं, डायबिटीज़ की बात करते हैं. एंड वी ऑल्सो ट्राई टू मेक यू अवेयर ऑफ ऑल द थिंग्स दैट कम अलॉन्ग विद डायबिटीज़. और एक चीज़ जो मुझे अब भी लगता है कि लोगों को नहीं पता है वो है कि डायबिटीज़ की वजह से आपकी आई साइट परमानेंटली जा सकती है. और ये इतनी बड़ी बात है, और मेरे लिए दिस इज़ वेरी क्लोज टू माई हार्ट दिस पर्टिकुलर टॉपिक, बिकॉज माई फादर हैज़ एक्चुअली लॉस्ट हिज आई साइट बिकॉज ऑफ डायबिटीज़. He can barely see with his one functioning eye, which is not even fully functional. So काफ़ी सारे लोग हैं जो इस चीज़ को नहीं जानते, और by the time they get to know, it's too late. In fact, there's been a report in Khaleej Times also which talks about some case studies where a 58-year-old truck driver who had been living with diabetes, type 2 diabetes, 20 years से he was managing it well as well, but फिर भी एक दिन suddenly उनकी eyesight चली गई. Or same happened with another 52-year-old lady as well. Now this is a condition that not many know about, and it's very important to spread awareness about that. और उसी के लिए हमारे साथ Dr. Raeba Mathew है. She's an ophthalmologist, and she's joining us on the phone line. Hi doctor, how are you doing?
I'm good, thank you, Ronak. How are you?
I'm good. Thank you so much for asking. So doctor, am I right? People don't have this awareness even today that diabetes can actually take away your eyesight for life.
Yeah, you're correct. A lot of people are not aware. When they are diabetic, they go to the general physician, they get themselves treated, try to control the diabetes. But some are quite surprised when you tell them that diabetes can affect the eyes.
Okay. And why does it happen?
Okay, so diabetes is a condition which can affect all parts of the body, including the eye. And it affects mainly the blood vessels of the body. And the eye condition, that what we call the diabetic retinopathy, as it affects the retina, the nerve layer inside the eye. This there are two main factors. One is the duration of diabetes, and the second is the control of diabetes. So when a person has long years of diabetes, the disease invariably affects the blood vessels in the eye. And about the control of diabetes, if initially the control is very bad, then this hastens the severity of the diabetic retinopathy. So
Right.
we cannot control the duration, because that is something which naturally happens. But at least we can control the diabetic level in the body, which is very important.
But when somebody is going through this kind of an issue where your body is presenting some symptoms of diabetic retinopathy, then what are those? Or does it not give you those signs?
See, that is the main part of it. A person can have diabetic retinopathy. And diabetic retinopathy, by the way, we grade it into mild, moderate, severe. And then it goes on to the stage where it starts affecting the vision. So, as it passes through the previous stages, the person may not be even aware. And the diabetic retinopathy manifests to the person when it starts leakage in the center of the eye, which presents with blurring of vision, or we have these abnormal blood vessels which grow in the retina, and one day suddenly it ruptures, and then it causes bleeding inside the eye, which can lead to vision issues. That is the time people are aware of their diabetic retinopathy.
But are there any symptoms like blurring of vision or any sort of things that you see while
Uh,
the
yeah,
condition is progressing?
Not really. So this is where we need to do a proper screening of diabetes, diabetic retinopathy. So
Okay.
this should start as soon as the disease is diagnosed.
Okay.
When a person is diagnosed with diabetes, that at that stage they need to have a
Eye
diabetic
checkup.
eye
Okay.
checkup. And I stress that this diabetic eye checkup is different from what is normally done with the optician in an optical shop.
Right.
The
Absolutely.
that diabetic eye checkup involves coming to an ophthalmologist, getting a detailed check for the back of the eye or the retina, and a scan for the retina if deemed necessary.
Right.
And this checkup has to be done every year or more frequently based on the severity of diabetic
Okay,
retinopathy.
but once you check somebody's eyes because that person has diabetes, you'll be able to, as an ophthalmologist, you'll be able to tell whether this person is at
Definitely,
risk or not.
definitely. See,
Okay,
the risk is always there. As soon as a person is diagnosed with diabetes, the risk of having diabetic retinopathy is there.
is there? Okay.
So
Is there
the
anything we
main
can do to like minimize the risk except uh, controlling the sugar levels?
control of sugar level is paramount, and then regular screening is very important
Nothing you
because
can eat, nothing you can do, no exercise can actually stop it.
no, all these help to control the diabetes, which in turn will control the
Okay,
appearance of diabetic retinopathy.
okay. And finally, doctor, why is there no cure for it, or is there any?
There is cure. We don't wait till diabetic retinopathy has damaged the retina so much. In cases where there is leakage in the center of the eye, we have treatment, which is actually injections into the eye. I know it sounds terrible, but it's not as bad as it sounds.
Avastin,
And
is it?
sorry, right now, Avastin is a drug which is not recognized, which is not approved for use in the eye, although diluted form is used in the eye. But we have approved drugs like Lucentis, Eylea. A lot of these drugs are there, which can be injected into
But
the
that, correct me if I'm wrong, that can only be done in the first few days of diabetic retinopathy setting in. After
eye.
a,
Not really. If we find that the person has leakage into the center of the eye, and we can document it on the retinal scan, that is the time we decide to do the injection.
okay,
And these injections, the effect lasts only for a month. So a person will need to be under regular checkup, and repeat injections may be necessary.
okay. And but once your eye vision, once your vision is lost because of diabetes or diabetic retinopathy, it won't come back. I- Is
So
that
that
so?
depends. Yeah, that depends on how bad the diabetic retinopathy is. In the advanced stage, when there is total damage of the retina, or when those abnormal blood vessels have grown and there are fibrous changes in the eye, that is what we call end-stage diabetic retinopathy.
Which
So,
can,
which may be difficult to treat, but no, nobody should go to that stage. In fact, they will not reach that stage if we do regular screening.
all
So
right.
this is why screenings are very, very important.
That's the big takeaway. Thank you so much, doctor. We'll leave it at that.
Okay.